Well, for me, it's about changing lives. People who have blood-borne viruses quite often get or feel like they're being discriminated against.
There have been huge medical advances for all of the blood-borne viruses in the UK. Challenge is that we've got these medical advances, but very few people know about them.
Common misconceptions when people think about health and safety policies are that because a person is known to be living with a blood-borne virus, they are automatically going to transmit that virus and that they're the biggest risk, when actually a bigger risk is people that may be unaware of their blood-borne virus status. And actually, that's why we need to treat everybody the same.
Project started based on a conversation with the chief executive of an HIV support organisation here in Bristol. What he talked about is the fact that if we really want to tackle HIV stigma, we need to get into the health and safety documentations and the day-to-day working policy of local organisations. Those who got involved include a local rugby team, a local emergency response organisation, a community arts organisation, an educational institution, and also an organisation that supports young people who are facing homelessness.
Unlike most academic projects, we're inviting a lot of community researchers and also different organizations within the city to participate in this project.
You know, even though the project was being funded and led by the University of Bristol, it wasn't hierarchical in that sense, and that we jointly decided on the way forward and what was important.
One of the first things that we are already planning to do is work with the National AIDS Trust in support of the Health and Safety Executive nationally to help them understand what organisations need from their national guidance.
I think the change I want to see is I would like to see people's health and safety policies reflect the reality of what living with HIV or another blood-borne virus is today. And if they're reflecting the science, hopefully that reduces the stigma. And if the stigma can be reduced, then people living with HIV might experience less discrimination. And I think that would be the goal for me in the next 10 years.